Epilepsy is defined by the ILAE as a disorder of the brain, characterized by a predisposition to generate epileptic seizures by neurological, cognitive, and physiological consequences of the condition. An epileptic seizure is a temporary occurrence of signs and symptoms due to the abnormal and excessive neural brain activity. At least 2 seizures are required for diagnosis. Etiology of epilepsy. Abnormalities in structural neuroimaging are brought on by trauma, stroke, infection, and genetic malfunctions in cortical development. These include genetic mutations of a gene or several genes that result in seizures as a symptom of autosomal dominant disorder seen in families. Infectious is the most common etiology of epilepsy. It is a direct result from infection causing seizures in a patient. Metabolic epilepsy that is associated with metabolic disorders that results in seizures as a core symptom. This is a result of immune disorders where seizures are a core symptom of the disease, such as autoimmune mediated central nervous system inflammation. As the name suggests, the etiology of the epilepsy is not known. This is a substantial problem for patients as the only diagnosis possible at this stage is basic frontal lobe epilepsy. Epilepsy is a chronic brain disorder that affects people of all ages, types, and ethnic backgrounds. More than 65 million people worldwide suffer from epilepsy, and approximately over 250,000 Australians are currently living with the disease. Epilepsies classified by seizure types are focal, generalized focal, and unknown. Focal epilepsy involves unifocal and multifocal disorders, with seizures involving one hemisphere of the brain. Generalized epilepsy has no apparent causes, which is the opposite to focal seizures, as they distort large proportions of the cortical and subcortical structures or the entire cortex's electrical activity. Combined generalized and focal epilepsy are patients who suffer a combination of both symptoms, and the unknown category is used by clinicians when they are unable to diagnose the type of epilepsy. Increased neuronal excitability is caused by a prolonged discharge of neurons, high-frequency bursts of action potential, and hypersynchronization. Abnormal cellular discharge is due to the activity associated with trauma, oxygen deprivation, infection, metabolic imbalances, and tumors. Mutation in ion channels results in the depolarization of neural membranes. Signs and symptoms of epilepsy.
The first episode I had when I was about 15 years of age, I'd been out drinking, had a very solid night, a couple of nights, and basically just passed out to the best of my knowledge. Little did I know that I actually had an epileptic fit at that stage.
So would you mind telling me about some of the signs and symptoms and how you feel when you're about to have a fit?
I've learnt over the years after taking a number of fits that the signs are basically feeling very anxious, tingling over the body, and then everything just gets dark and cloudy, and then basically at that stage I've passed out, and then I've had people around me telling me that I've been moving or bouncing around, and so I'm just trying to look after me. So it's hard to describe. I think everybody has it differently, but for me it's more of an anxious, tired feeling, and then basically I pass out. A medication called Tegretol, that did not agree with me at all. It made me very, very sick. I would just collapse on the ground, vomit, but unfortunately I had to stay on that for nearly 6 to 8 weeks. They then put me onto Dilantin, which I take 150 mils in the morning and 200 at night. So that's 5 tablets basically every day. That has totally controlled the epilepsy. I haven't had a fit or a seizure since.